Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Sunanda Kulkarni, a good friend of mine, but a Guru Bandhu. Her father was my professor, R.H. Kulkarni, and he was a great professor. And Sunanda herself is a gold medalist for MBBS, and then she did her post-graduation in gynecology and obstetrics, and she has worked in many medical colleges, and she retired as a professor, head of the department of Bangalore Medical College. And after retirement, she's still working, and in spite of her age and everything, she has never stopped working and never stopped serving the society. And now she's in the Chinmaya Mission Hospital as a gynecologist and obstetrician. More than that, she is a prolific writer. She has written hundreds of books, and that too to bring awareness among the people about the ill health during the pregnancy or delivery or any women related problems. And not only that, she has written the textbooks for the medical students also. And today she is here to tell us about a very common problem among the women, which is really annoying them and worrisome. And that is Hirsutism. Welcome, Dr. Sunanda. It's a pleasure to have you with us.
Thank you for the opportunity.
Hirsutism, having lots of hair on the face, like a mustaches and the beard and on the chest, that is really troublesome for the women. And in fact, if you take the nature, the males are very beautiful among the birds and the animals. But in a human race, women are the ones with the very smooth and the beautiful face, but lots of hair on the head. And when they become like men and get mustaches and the beard, it really takes away the feminism. And that's how, please tell us, what are the causes for this hirsutism or plenty of hair on the face and the chest, and how to tackle them?
See, hirsutism, the incidence is about 5 to 10%. And if you see in our country, especially in Punjab, their complexion is good. They are fair, and in them you can see a little bit more hair compared to the South Indian girls.
And it becomes obvious.
Yeah. And then if you see the Japanese, Chinese, this Mongolian race, so in them the hair growth is less. Even in men also it is less. So if you see old movies or now in the Japanese and Chinese movies, you can see beard, only very small beard they show.
Only this much.
Yeah, this much they will show. So like that, our East Indians.
Like a goat, like a goat.
Yeah.
Goat
so in
beard.
East Indians also you can see there is a less growth, not much growth. So South Indians and the East Indians, it is slightly more on the Punjab side, that side. And see this hair, it has 4 functions. That's why hair is growing on our body. So hair is seen not only in men, even women, and in the newborn also. In the newborn, it is very thin, and it is somewhat chocolate colored, and then it is very small also. So it falls off, and then the adult hair comes. So it is a irreversible process. And this hair growth has 4 phases: anaphase, cataphase, telophase, and exophase. Anagen, catagen, telogen, and the exogen. So in exogen, it falls off. And in the telogen, it is when it is grown, it lasts for many days. It lasts in the head, it may last 2 to 5 years, but it is not so in other areas. So like eyelashes and the eyebrows. And there are sexual hairs, which are in the adult life, we get that, both in male and the female. The sexual hairs are
the girl, when she attains menarche, she starts getting that. Those called as secondary
so axillary hair and the pubic hair. So the distribution of this hair in male, it is different, and in the female, the sexual hair is different. But the hair growth on the scalp, it is luxurious, but in the male, there is a frontal residence. It is not there in the
on either side. That is called as the male hair. Receding
and
hair.
In the male, and in the male, the hair growth you may see in the nose and in the ears also. Now, old ladies after menopause, sometimes you may see the hair growth on their ears also. That is after menopause. Before menopause, it is not there. So this is about the hair, and with the functions of the hair are it is a temperature regulator. It reduces the friction. It protects the skin from the ultraviolet rays, and then your sensor it acts as a sensory organ also. Now this hair it is
And
seen.
also it beautifies also for
Yes,
the
yes,
so
it
for
is
the
a
girls,
sexual attraction.
Nagaveni, very attractive
It
for
is
the
a
girls,
yes,
as
it
well
is
as the mustaches for the men. They're all attractive also. Yes.
attraction, sexual
Yeah.
attraction also.
Yes.
Okay. Now the reasons this is because of the male hormone. Now this male hormone may be secreted. It may be sometimes familial in some ladies in some families it may run. So they may have a little bit more hair. Otherwise, it is usually due to other causes like there may be some tumors from the ovary. So ovary produces different varieties of tumors, and one of them is the producing the male type of hormones. And then
Okay.
there are glands called as adrenal glands, and from there, see, either due to existing the cells may become hyperplasia, more cells, or there may be sometimes tumors.
A
So because
tumor.
of that, male hormone is secreted, and sometimes due to thyroid gland also, and sometimes the one more gland is there in the brain that is called
Pituitary.
as pituitary gland. So when the particular secretion is increased in the pituitary gland, then there will be more secretion of the male hormones from the adrenals. So these are the reasons. So whenever the patient comes with that history, and what happens in the young girls, they feel very shy, they stop going to college, they stop
Yeah.
going to school, and they feel very awkward. And if they are,
Yeah.
especially they are fair, it is still more problem.
Hmm.
So when the patient comes, we have to tell that there is solution. There is a solution for everything in this world. And then
Yes.
you have to find out not just shaving the hair, the
Uh,
treatment of the hair removal. Well, no, not that. You should
what are
find
the
out what is the reason.
investigations? What are the investigations
Yes,
available?
what are the reason? What is the reason? To know the
Correct.
reason, what you should do is do varieties of blood test and find out whether it is from the ovary, whether it is from the adrenal, whether it is from thyroid, and what is the level. And then you do the scan and find out whether is there any ovarian tumors or adrenal problem. And then sometimes you may need the CT and MRI, whether the pituitary, how is the pituitary to see that. And if you find out the reason, first is, and then I forgot to tell one more thing. Sometimes the doctors are also responsible. So some of the yes,
Iatrogenic. Iatrogenic.
iatrogenic. So
Yes.
we give tablet to cure something. So
Hmm.
to cure something
As a
we give,
side
and
effect,
then
you get this.
because of that they get some other thing.
So you
So
take one and get one free, So this hirsutism comes free of cost with that treatment.
buy one and take one like
Take
that.
one, yeah.
Yeah, take one. So if you have to ask all this her history, what drug medications she is taking, for what she is taking, then you can change the medication. Not necessarily
Yes.
that she should take that
So
medicine only. You
alternative
can
things
change
are
the
there.
medication. So and then if there is then you have to do surgery if there are tumors, and depending on the where it is arise from where it is arising. After that, you can give tablets, the tablet to stop it. And but what happens if you even if she stops taking tablets, then also immediately it will not hair will be there. It takes 6 times more than 6 months to
Yes.
disappear. So she has
Yes.
to wait, and then
Yes.
you
Yeah.
can give the tablets to her. But you have to be careful. These tablets sometimes they stop producing the male hormone, so she should not become pregnant because the baby, unborn baby, maybe sometimes maybe male. That's why they should take all precautions so that she will not become pregnant. So she should take some family planning, adopt some family planning method, and she should
Yes.
not become pregnant as long as she is taking the treatment.
Taking the
And
treatment.
and now what we should do? The hair is already grown now, so there are different methods, but each method has got its own problem. Now, shaving, if you shave today, tomorrow again it will
It
appear,
looks very
and then
bad like
you may
man,
injure your
Yeah, yeah, yeah.
yes, skin also,
The
and
manly look
every
and
day
the hair becomes thicker and bigger.
be
After
thicker.
shaving, the hair becomes still thicker and
Thicker
blacker.
and bigger.
Yeah.
And see, they go somewhere and is every day shaving like a man. man, it becomes very awkward
Be
for
very
them.
awkward,
So that's
yes.
one. And threading. So individually, by the thread, you remove one
Very painful,
the hair
very
follicle,
painful.
but it is painful. And then next is the epilation. So there is an instrument. It removes its root of the this one of the hair, and that is the epilation. Now there are
And they
depilation
do
creams.
some bleaching also. They do the bleaching. So
Yes,
instead of black, it becomes little golden color. So it is not obviously slain. And
but it's
that
still
is
there.
okay
It
if
will be
it is
still
still
there.
there. Hair is
Yeah.
there, but the color is, I
So
think.
if you
Or they can
observe
do
closely,
waxing. Yeah, yeah,
yeah,
yeah.
if you
Waxing can be
observe
done
closely, the color may be different, but it will be there.
there.
So
Yeah.
next is the depilation cream. So
Hmm.
depilation cream you apply and leave for some time, and afterwards, if you wash, it will go off. It is not
Hmm.
painful. But
Hmm.
every tablet, every method has got its own problem.
Hmm.
Okay. Now next is the laser. If the
Hmm.
large area is there, then better to do laser. But
Hmm.
laser has got its own problem.
Hmm.
It is works on the light rays. Okay.
Yeah.
So
And it burns. It
and
burns.
it burns. And the laser, if the hair is colored, it works well. If the hair
Hmm.
is light colored, it may
Hmm.
not work well.
Hmm.
But the other one is the electrolysis.
Hmm.
In electrolysis,
Hmm.
whatever may be the color of the hair, it will remove. So it is
Hmm.
operator dependent. Whereas the
Hmm.
laser, you can
Hmm.
do it. And
Hmm.
then the laser for the large area, and
Hmm.
then so for so many months or years, it gives relief. But
Hmm.
sometimes it may recur also. In
Hmm.
electrolysis, it is almost permanent, but it has
Hmm.
got its own problem.
Hmm.
So there it may produce erythema, it may produce bleb, sometimes it may produce a scar. So it has got its own problem. So
Hmm.
every method has its own problem.
Hmm. Side effects. Yeah, yeah. And you know,
Mm.
nowadays the women are becoming feminist. They want to be equal to men. And let them not think that equal to men means having a beard and dadi is mustache is not being equal to them. So
Mm.
it can be a serious problem. So that has to be thought. If the serious problem is not there, then you don't have to worry. So best thing is to go to the consultant, get the investigation done, and have the proper treatment done. So instead of worrying and instead of getting depressed or feeling bad and leaving, you know, like your one of your patient had stopped to going to school, and my own you know friend, when she brought her daughter and she started doing namaskar, I didn't realize when she got up, I realized she had so much of hair on the face and the beard and the mustaches. And then I said, joining medical college is okay, but first go to endocrinologist, because that is important, because she's spending all her time in studies but not worried about her face. Then I said that is also equally important. Anything else you want to tell ultimately to
Yes,
our viewers?
see, in somewhere I saw one photograph, husband and wife with a child. And
Huh.
then you cannot make out who is husband, who is wife. See, both of up to the bust, both of them had beard. That picture, I searched that picture. I wanted to show, but I didn't get that picture. So that is one. And the other thing,
But how did
what
they get the child? If both of them have got testosterone, male hormone, how did she become pregnant?
no,
That's
it may be a rare case of a PCOD. In PCOD,
ah,
there are again varieties. Four varieties
okay.
are there. In one,
Hmm.
they ovulate. So
Yeah,
maybe
yeah,
she's
okay.
ovulating, but maybe
Yes.
having a beard and all that. So
Yeah.
it was very difficult to find out who is the man and who is the woman. That is
And you
the
know, in a lighter vein, in the past they used to say, you know, to control the husband, juttu hidibeko, you know, holding the
oh.
juttu. But now they can hold the dadi and they control them.
Yeah, yes, yes.
Hmm.
Okay. Now, yeah.
I think, you
These
know,
patients,
yeah.
one more thing what I wanted to say is that these patients can go to gynecologist or this one dermatologist, they will do other things.
Okay, thank you so much, Dr. Sunanda, for explaining so nicely about the common problem of hirsutism. And let them not take it very seriously if it is not serious, but let them not neglect it, because if there are any tumors, they have to be treated. So, the anyone who has got a hirsutism, instead of going to the beauty parlor, they should go to the gynecologist or the dermatologist, and that is our message to the viewers. Thank you so much.
Thank you. Thank you.